Good afternoon and welcome to today's National Resource Center on Nutrition and Aging's conversation with Lance Robertson, ACL Administrator and Assistant Secretary for Aging. Thank you so much for joining us today. We'll begin today's webinar with a few words from Dr. Uche Akubondu, the Director of the National Resource Center on Nutrition and Aging, and Holly Grueling, Registered Dietitian Nutritionist and Senior National Nutritionist for the Administration on Aging. And then we'll hear from Lance Robertson. Mr. Robertson was appointed to serve as Assistant Secretary for Aging and ACL's Administrator on August 11, 2017. His vision for ACL focuses on 5 pillars: supporting families and caregivers, protecting rights and preventing abuse, connecting people to resources, expanding employment opportunities, and strengthening the aging and disability network. His leadership in the fields of aging and disability began in Oklahoma, where he served for 10 years as the Director of Aging Services within the state's Department of Human Services. Prior to that, he spent 12 years at Oklahoma State University, where he co-founded the Gerontology Institute and served as the Executive Director of the nation's largest regional gerontology association. Assistant Secretary Robertson earned his undergraduate degree from Oklahoma State University and a Master's of Public Administration degree from the University of Central Oklahoma. And he is a veteran of the United States Army. And with that, I turn things over to Uche.
Great. Thank you so much, Sharon. Welcome to everyone. Thank you so much for taking time out to join the webinar today. First, I'll just share with you an overview of how things will proceed. We'll be starting with some welcome and some opening remarks. I'll be setting the stage, and then we'll go on to hear from Lance Robertson. We'll conclude with questions and answers, and there will be closing remarks, and we'll invite you all to participate in an evaluation at the end of the webinar. So first, in terms of setting the stage, it is so clear and part of the theme for our National Nutrition Month celebrations today that the Older Americans Act meals are part of the equation. When we say this today and focus on the meal being part of the equation, we want to make sure that we understand that there are many parts to the equation that is providing nutrition support in the community. There's technical assistance aspects, education, and long-term services and supports. We say this in terms of the value that nutrition provides to older adults in remaining well and experiencing independence in the community. National Nutrition Month is a perfect opportunity for the Nutrition and Aging Network to leverage this annual information and nutrition education campaign to highlight why nutrition matters. You will have opportunities in this webinar to share how you are amplifying the importance of nutrition this month for your programs. One of the ways we will do that and talk about how nutrition is part of the equation for overall health is talking a little bit about the social determinants of health. What does this mean? More and more, we're recognizing that health happens both in clinical and non-clinical settings. Social aspects of health are even as important as medical aspects as well. Social determinants of health describe many of the factors that combine to affect the health of individuals and communities. The factors noted on this slide represent the social and environmental factors, and you can see that your programs provide services that address many of these myriad factors. We'll be talking a little bit more and more about this, but today we are focusing on the role of food, particularly nutrition, in addressing health in its broadest form. I'm going to turn things over to Holly Grueling to take it away and talk more about the value and importance of nutrition, especially today.
Thank you, everybody, for attending this webinar. We are very pleased that the National Resource Center on Nutrition and Aging was able to put together this webinar to highlight the Assistant Secretary, Lance Robertson. But before he gets started, I would like to just bring out that today is, this is National Nutrition Month. However, the whole day today is Registered Nutritionist Day, Registered Dietitian and Nutritionist Day. So to all of those out there that are listening, here is to you, and here is to those of us that work in this aging network. It is a very unique area to work in, which requires the dietitian to have multiple business aspects to his or her knowledge-based as well as nutritional. So I do want to say thank you all for working in this arena, and I look forward to working for us all together in the future. This slide here, on slide number 7, shows 2 graphics that the agency has created to celebrate National Nutrition Month. I personally think they're fantastic. At the bottom of the one on the left, it does have a hashtag. For those of you that are familiar with Twitter, that is the hashtag that we're using this month. And the second one is just a quick snapshot of what we do every day. So as a group, we are all together serving more than 900,000 meals per day, and that is remarkable. The other 2 graphics on slide number 8 are also for your use if you are able to download them. The External Affairs of the agency has Facebook and Twitter, both under AOA and ACL. And if you aren't connected, please consider joining us and then sharing these. There's going to be 5 more graphics coming throughout the month, and you are welcome to use these graphics as you see fit in the appropriate manner. Lance Robertson is also authoring a blog, which will come out by the end of the month, talking about National Nutrition Month and the importance for nutrition for the populations that we serve. So, without further ado, I'd like to introduce our guest speaker, Mr. Lance Robertson. Take it away.
All right. Well, thank you, Holly. Hello, everyone. Happy Wednesday. Hope you've had a great day. It's really great to be with you to virtually celebrate National Nutrition Month 2018. They shared my bio a little bit earlier, and all I'll reemphasize for you is that in my 10 years in serving as the state's Director of Aging Services in Oklahoma, it was my privilege to work with our network there, who each and every day worked tirelessly to make sure that meals were provided to individuals in need. And I myself had been involved in delivering some of those meals going to congregate sites. I have firsthand experience in knowing the critical work that each one of you do every day, and I want to thank you for that from the bottom of my heart. So again, thank you for being part of this webinar and for an opportunity to just talk a little bit about what's happening, and particularly on the Older Americans Act side relative to our nutrition programs, and then possibly answer some questions at the end of the webinar should we run out of time. You know that we have people available, resource folks available to you all the time, including the outstanding Technical Resource Center, who is in your corner, and like all of us, wants to make sure that you are empowered and equipped to be as successful as you can be. So ACL improves the lives of older adults and people with disabilities through services, research, and education. We were created around the fundamental principle that all people, regardless of age or disability, should be able to live independently and fully participate in their community. Most of you as grantees know that, and of course the Older Americans Act nutrition programs play a critical and important role in making that possible for millions of people. In fact, Older Americans Act nutrition programs is the largest federally funded nutrition program for seniors. So let's talk a little bit about the history and some overview of the Older Americans Act nutrition programs. As most of you probably know, the Older Americans Act was passed in 1965, as indicated in the graphic in front of you, along with Medicare and Medicaid. You probably may not know, though, that shortly thereafter was when Congress acknowledged the importance of good nutrition for older adults, and they created 2 nutrition programs. These programs, of course, are designed to promote the general health and well-being of older adults by reducing food and hunger insecurity, or hunger and food insecurity, promoting socialization, and delaying the onset of adverse health conditions. So it was 1972 when the Congregate Meal Program was added. So, of course, we're happy to be celebrating the 46th year of that program. And, of course, that Congregate Meal Program brings together people for meals in a group setting, such as senior centers. And then 6 years later, 1978, was when the Home Delivery Meals Program was established. And, of course, we're celebrating its 40th year. and it provides meals for frail, homebound, and isolated individuals. So, of course, we have a polling question for you. How long have you worked in the Aging Network? So we invite you to answer that question. You can see your options there.
Great. Thank you so much, Lance. So how long have you worked in the Aging Network? Please select one of these: 20 years or more, 10 years or more, 3 years or more, or less than 3 years. You have a couple of minutes to vote, so please select one of these options. Great. Thank you so very much for your contribution. So it seems like there is a large segment of the population on the call today that's been working the network for 20 years or more. Those individuals followed closely who have been working in the network for 10 years or more, and also 3 years or more, and then finally less than 3 years. So thank you all so much.
All right, thank you. That does not surprise me. I know with the folks I worked with in Oklahoma, and the more individuals and colleagues I've learned about their great work across the country, the resounding theme is that commitment that often transcends not just months and years, but sometimes decades. Okay, so both programs serve people age 60 and older, and in some cases, their caregivers, spouses, and people with disabilities. In addition, both programs offer nutrition-related services as well as other important benefits in addition to the meal. That's why ACL's theme for National Nutrition Month is, and I quote, "The meal is only part of the equation," end quote. Older Americans Act nutrition programs are more than just healthy meals, although they certainly are that as well. Congregate meals, as an example, provide companionship, access to other health activities, and wellness programs. Nearly 2/3 of meal providers offer health promotion programming. On the home delivered meal side, of course, we know those meals provide healthy food, an opportunity, a very critical one, for an informal safety check and companionship. Sometimes those meal delivery people are the only person a participant may routinely see. The meal and the informal safety check makes the participants feel better and helps keep them in their homes. Why is that important? Because homebound recipients are frailer now than in the past, and we'll talk about that here in a moment. Let's transition now and talk about why the Older Americans Act programs are so important. And because of so many various inefficiencies, older adults are particularly more vulnerable to becoming malnourished and suffer from its consequences, as we all recognize. Malnutrition is connected to a variety of poor health outcomes, including increased hospital utilization. People who are malnourished are more likely to be hospitalized, tend to experience longer hospital stays, and are more likely to be readmitted after discharge. Shifting to hunger, in addition, although it's hard to believe in this day and age, nearly 1 in 10 older adults are food insecure. They consistently do not have enough food or other resources to ensure they have access to adequate food. And we all anticipate that actual number could probably even be higher than research shows. Food insecure seniors are more likely to have health issues, of course, than food secure seniors. Talking about a few of those statistics, a food insecure senior is 65% more likely to be diabetic, 57% more likely to have congestive heart failure, 66% more likely to have experienced a heart attack, twice as likely to have gum disease, and then 91% more likely to have asthma, as the statistics on that slide show you. Now, our recent evaluation also indicates some things that you'll be interested in knowing. You can see the statistics up there. About 86% on average of our meal participants stated the program had helped them to eat healthier foods. 73% on average indicated the program had improved their health and helped them to achieve and maintain a healthy weight. And then most importantly, 8 in 10 of our participants report that the program has helped them live independently and remain in their home, which ties into that social determinants of health remark that was made earlier. So we're looking forward to more outcome data that's coming out soon. This fall, maybe a little bit earlier, we anticipate the release of the second part of the nutrition program's client outcome evaluation. Now, this report will help us provide research data about our participants' health status. For example, we will have now data about the average participant's current functional ability and frequency of falls. And then in addition, this evaluation will compare participants to similar non-participants. By comparing these two groups, the report will examine the effect of the nutrition program on participants' health outcomes and healthcare costs. Let's talk a little bit now about who we serve. I think some fresh data might be helpful for all of us. Nutrition programs vary greatly across the nation and from place to place, and of course, demographics may be different. Now, in the recent Administration on Aging Outcomes Study and Evaluation, we know the following about our participants. More than 2/3 are women. On average, 16% are veterans. 60% of participants live alone. You have up there, although I was going to quiz you on what the average age might be, but you can see that the average age for someone who receives a home-delivered meal is 82 versus 77 for those participants who come to our congregate meal sites. Nearly half of home-delivered meal participants were widowed compared, on average, about half of our participants are widowed. Over 1/3 of home-delivered meal participants and all participants in general had annual household incomes below 100% of the federal poverty guideline. This is reinforced by the state program reports data, which shows that approximately 71% of home-delivered meal recipients have annual incomes at or below $20,000 a year. The Old Americans Act directs local providers, as we all know, to target services, certainly to those who are in the greatest social and economic need. Many of you are probably familiar with those target requirements: low-income individuals, minority individuals, older individuals in rural communities, older individuals with limited English proficiency, and older individuals at risk of institutional care. Those, of course, are the targets, and the data shows that we're doing this well, so we're proud of that. The older adults we serve through the Home Delivered Meals program also face greater risk of independence to their independence than ever before. So let's talk a little bit about that and their frailty. So if you look at the data between 2005 and 2015, back in 2005, 33% of our participants lived with 3 or more impairments to their ADLs. In 2015, that percentage climbed to 42%. So that's a 26% increase in 10 years. And as you know, 3 or more ADL deficiencies generally means that person is quite frail and high risk for nursing home entry. The Homebound Nutrition Program offers these individuals assistance to help them remain in their homes. Any, if not most, of our participants also have one or more chronic health condition that can negatively impact their health status. So we now turn to our next polling question.
Great, thank you so very much. So the polling question that will appear shortly will invite you to provide your input on: does your program require routine reassessment for home-delivered participants? And if so, how often? Here are your options. No reassessment is required. No, except if there are significant changes. Yes, reassessment is required annually, semi-annually, or quarterly. So please enter your responses, and we'll give you all a couple of minutes to enter this information. Okay. Thank you so much. We'll go ahead and close the poll. For the majority of those responding, reassessments occur annually. That's followed up by semi-annually, and then we have less than 10% in other response categories. Thanks so much for your input.
All right, wonderful. So input for the 2020 to 2025 Dietary Guidelines for Americans is being solicited right now to help determine whether and how dietary patterns can be used for older adults to promote health, prevent diseases, particularly chronic disease, and we're eager to see what they come up with, and we certainly want to encourage you to submit some input. You have a couple more weeks. The deadline is March 30th, and you can visit the website dietaryguidelines.gov to submit your comments. So let's shift now, and you can see on the slide in front of you.
We're just a little ahead on that slide.
Okay. Excellent. Okay, let's talk a second then before we get to the slide in front of you about kind of the increase in demand that we all know to be the case throughout our country. So It's important to note that when Congress wrote the Older Americans Act, they did not, of course, make the Older Americans Act nutrition program an entitlement like Social Security. So, of course, what does that mean? Well, that simply means that federal funding is not tied to population growth. That doesn't surprise you. What will not likewise surprise you is that, as we all know, the aging population is growing at an unprecedented rate. We have approximately 10,000 people in our wonderful country that turn 65 each day. And here in just a couple of years, really, we'll be at that marker of 77 million Americans over the age of 60. And at the same time, people are also living longer. So the demand for the services that you provide, that we provide each and every day through the critical Older Americans Act nutrition program, that demand is just going to continue to increase. And we must step up to the challenge to balance that in a tight budget environment, both at the federal level, knowing that it may not keep pace, of course, with the needs. We recognize as well that at the state and local level, budgets are tight. So again, at all three levels, we understand the fiscal pressure that exists when you butt that up against the demand. Many nutrition programs are increasingly having to do more with less. And they are having to triage and prioritize services to those who are most in need. But you need to rest assured that here at ACL, we're going to continue to work hard to promote this program, its cost effectiveness, and the healthcare savings. We continue to have conversations about how we connect those human services conversations with the ever popular health conversation. And it's more important than ever before that we find ways to be efficient, innovative, and creative in ways we operate. So, of course, this also includes key partnerships across all sectors. That's a focus here at ACL. For all our programs, we have to make sure that the aging and disability networks are as successful as they can be, and that we're building in long-term sustainability so that together we're able to continue providing the critical services to people who need them so desperately. So now to the slide that's in front of you. Excited to share with you 7 different stories, 6 short stories about some of the innovative things that are happening across our country. And I loved reading about this earlier. I think our first example starts in the great state of Texas, at least in my notes. So we'll start with Texas and work our way across the country. Some professionals in the Aging Network, again, are partnering with hospitals and focusing on care transitions as well as many other types of innovative partnering that is directly improving the lives of seniors in their communities. For example, one provider from Texas is partnering with 2 local hospital systems to provide short-term meal service, wellness and safety checks, and daily health assessments with their senior partners who are at high risk of being re-hospitalized after discharge from the emergency room or rehab. And again, this goes back to what we were saying earlier about strengthening our networks, better integrating the services provided by our networks into the overall healthcare system. Certainly, it's a critical component of making it possible for our country to meet those growing needs we just referenced. And when we can work together like this, overall costs are lower, and most important, people are able to continue living independently, which is what they want. So we have another example out of the great state of Pennsylvania. A provider from Pennsylvania has expanded the use of their meal delivery software. So in addition to using the software to record the meal delivery, the driver also asked the participants 6 easy-to-answer questions. So these questions are used by a nurse back at the office to see if any of the participants had a health status change that may warrant further investigation. And if so, then the RN communicates that with the participant's health provider. Let's go all the way out west and talk about California. A provider in California has identified a few home delivered meal recipients who are in need of extra attention because they show signs of loneliness. So to better serve these participants, they created 2 small meal routes that have only 4 to 6 people per route. And they're using specially trained volunteers and staff to deliver those meals so that those individuals can purposely spend extra time with each client. They're measuring change in condition using the UCLA loneliness scale. That's a pretty exciting one. Glad to hear about the work they're doing out there. Connecticut, a provider in Connecticut has provided a chef on-site program at 2 of their meal sites. A chef has been contracted to work at these sites. The chef has increased the use of locally grown products or farm to table. Is that not popular nowadays? Yes, it is. fresh-baked breads, and the ambiance of the program. Title III and a small grant from a local foundation fund these meals. And of course, as you can imagine, how's it been going? Well, that meal site participation has grown since the creation of this program. One of the sites went from serving 5 people a day to nearly 45 folks each day. Let's move back east towards the center of the country and talk about what's happening in Wisconsin. We have a AAA in Wisconsin that's partnering with Sustainable Kitchens to improve meal quality and reach more people. The Sustainability Kitchen system is based on one simple notion. Food service menus do not need to rely on processed, pre-made convenience food. Instead, they can be comprised entirely of fresh meals made from scratch with local ingredients. So another exciting example to share of some innovative work happening comes from Connecticut. A provider in Connecticut built a food truck, another popular thing nowadays, a food truck called Meals in Motion, and plans to use it to serve underserved seniors. The provider plans to serve breakfast at one site and then move it to another site for lunch. They will plan to use that food truck occasionally at senior center events as well to kind of enhance that event, make it a little more trendy and popular. And then, of course, how do they cover the cost is a question I wondered myself. And to help generate income, they plan to use it for private functions. So all the monies raised, of course, will benefit their program. And then finally, from Nevada, we have a provider that launched a Meals on Two Wheels program where a volunteer delivers meals on bikes. And they stay, of course, for lunch with that senior. So, again, that's an excellent example of some very innovative work that's happening, as well as the other ones we listed. So we would say, though, that if you have others, we want to hear about them. We are all about celebrating those innovative things that are happening that we know are happening in every state across our country. So the success that these individuals are having is truly paving the way for the network. And it's helping to show the world that what we already know, and that is that this program is a difference maker. So let's now talk a little bit about the realities of knowing that certain agencies may not possess the level of sophistication, they may not have the risk tolerance, they may not even have the operational bandwidth to do some of the more innovative things that we just covered, but you play just as critical a role. Everybody can have play a key part in this ever evolving mosaic of work that we're doing. So, perhaps you can attend a local community meeting and share what you've seen, what you've learned, what the program's all about. Talk about how the program helped a neighbor stay at home. I know that you have local stories, and I want to encourage you to share your stories with the community and to include those that work outside of the network as well, so that we are ever broadening the sorts of folks that know about what we do and about how, as an example, this program can help offset healthcare expenditures. Again, another ask is that you would share your stories with us. You can share your stories about your innovative program by completing the survey at the end of the webinar, where I hope you will give me high ratings. And more than ever, it is critical that we work together to make sure that great things happen for the network and for the older adults that we serve across this great country. I have a great old African proverb here to quote you that summarizes this exactly. It says, "If you want to go fast, go alone. If you want to go far, go in a group." And then certainly as a network, we want to go far and continue to do great things. Let's talk a little bit about the Resource Center. The director talked to us a little bit about the Resource Center, and she's in the room with me, so we're going to plug it until she blushes. I want to encourage you to visit the National Resource Center on Nutrition and Aging. This Resource Center is funded, of course, by ACL for your benefit and was created with your needs in mind. If you are new to the network, it has information for you. If you are a trend-setting individual, it has contemporary and up-to-date information for you that, of course, you would be interested in. The center's primary activities are centered around enhancing the skills, knowledge, business acumen, and sustainability of the Senior Nutrition Network programs, as well as increasing the availability of information on nutrition programs and practice. If you're experienced in this field, and I think by that first question we asked, we have a lot of experienced folks on the line and participating in today's webinar, we want to encourage you to share your good works with the Resource Center. They may be able to add it to the website or use it in some other way. Their library has many resources training materials and research articles specifically on nutrition and aging that may help you. And then certainly if you are one of those highly seasoned individuals, we need you as a mentor. We have a lot of folks coming into the system throughout this country that could really use the knowledge that you have gained over the many years of doing what you do. And then also I'd ask you to, please be sure to visit the Resource Center, revisit them, tag them as a favorite. Again, check out that site often as they anticipate an updated website by the end of April. And again, we need your experience and feedback to help expand and improve our our National Resource Center on Nutrition and Aging. It is your tool, therefore your feedback is highly valued and encouraged. So a few final comments in closing. Every March, we join the Academy of Nutrition and Dietetics, Meals on Wheels America, and the National Association of Nutrition and Aging Programs, and of course all of you, in celebrating National Nutrition Month. This official observation helps us reflect on the nutrition services program and those who work in our wonderful nutrition field. Our programs are in all 50 states, the District of Columbia, 260 tribal organizations, and 5 territories through a network of more than 5,000 local service providers. Last year, the Aging Network supported approximately 216 million home-delivered and congregate meals for more than 2.3 million older Americans in a variety of community settings. And I want to take a moment here and just kind of pause and recognize the thousands of people across the country who help make the nutrition service programs possible. So again, a shout out and a thank you to, as an example, the cook who gets up at 3 a.m. to get things going and start that food prep, to the Congregate Dining Center's site manager, who's the jack of all trades, to the sociable meal server who makes it a pleasant experience, to the meal route coordinator who does miraculous work in ensuring that all seniors receive their nutritious meals in the most efficient manner possible, to the home delivered meal volunteers. You guys are saints who provide that friendly smile and informal safety check, to the nutritionists. Today's your day, apparently. Happy day to you. To the nutritionists who write the menus and provide nutrition education. Of course, to the often forgotten administrators in the back room who have to shuffle the 10 different things and all the reports that ACL requires, did I say that? To make the events of the day happen. And of course, to the state units on aging and the AAA staff who work hard to mentor and to support these critical programs, and of course to our tribal partners as well. And of course to all the countless others who make these nutritious meals and the rest of the equation happen in every community across this great country of ours. So I want to thank you for doing your part to serve our older population. I hope that you will never minimize the important role that you play and the contributions that you make each and every day. I know it can be a challenge at times, just given the pace of life today. But if you haven't recently, take time, pause, and just appreciate, again, the very relevant and critical role that you play in the lives of so many older adults each and every day. I'm incredibly thankful for that. This team at ACL is incredibly thankful for that. It's your smile, dedication, and can-do attitude that makes it all happen. And we thank you so very much. So I think with that, Holly and team, we have some time for questions.
Yes,
so
we do.
Again, turn it over to you guys.
Excellent. Thanks so very much for these inspiring and informative words. I think there's a lot to think about. And while you all are thinking about all that you've heard this afternoon, please feel free to click on over on the right-hand side of your screen to the chat box and enter questions so that we can have a robust conversation this afternoon. So I will get started with a question that's come in. Can you tell us, please, what can state units on aging, area agencies on aging, and local providers do to effectively advocate for our services and programs?
Excellent. Thank you. One thing we didn't clarify, didn't we all agree it's $5 a question? That's how we're doing the fundraising for, I'm just kidding.
Okay, put it on our bill.
Just kidding, just kidding. No, it's a great question. So really what you're talking about then is of course, within our structure, the partners we work with who at the state or local level administratively champion in many ways the work that's happening at the local level with nutrition providers. And the question involves how can they best support what's happening. So, I'll tell you, I spent some of the morning with my good friend, the Surgeon General, Jerome Adams, who is a big partnership guru as well. So his motto is partnering together for better health. And we similarly, I guess, could claim a logo or a motto around partnering. So I would say, again, having worked at the state level and can certainly attest having walked this walk and would encourage state units as well as AAAs to really begin as creatively as possible, looking at what sorts of partnering options are out there, whether it's with the faith-based community, whether it's with the for-profit industry. There are so many different examples and models of entities out there who we believe, if properly approached, might have interest. Maybe their help's little, maybe it's big. But again, I just think there's a bountiful number of opportunities out there for certain folks to plug in. I know in recent conversations I've had as well with public leaders, this is something that we, of course, want to remind locally elected officials, whether it's a mayor or a county commissioner or maybe even a governor, to recognize and appreciate the criticality of these services that are offered to so many of their citizens. And without these services, where would those voters be? So again, I think everybody plays a role here. The question, of course, and I would direct the answer towards partnerships and ultimately resources to really help bolster and create sustainability for the work that we do.
Great. Thank you so very much. And keep those questions coming. Here is the second question that we've received. All right. What is the number one priority that you have for the Older Americans Act nutrition programs during your tenure?
Great question. It's not a one-size-fits-all sort of answer, though. So, I think that for me, in a leadership role, is just helping those in key leadership positions. Maybe it's within HHS. For those of you who aren't aware, HHS is a multi-trillion-dollar agency. So, part of the challenge I have as assistant secretary is to make sure that our secretary, our deputy secretary, those in leadership positions, and then ultimately those that we work with on Capitol Hill, if they're not familiar with what we do, I need to make sure they get it, they understand, they appreciate it. We also need to make sure that we follow that up with good data, that we make sure that they understand the validity, the efficacy of what we do. I think that's a second part of what I want to see happen on our end. And then, I think that it's also just imperative that we remain committed. We don't know what's ahead relative to, example, federal funding, but that should not in any way shake our commitment to doing what we do. So again, what we'd love to be able to do is just to encourage you, and as I mentioned in my remarks, make it clear to you that there's not a day that goes by that we're not advocating very vehemently for this great program up here in DC.
Fantastic. Thank you so much. Here's another question that's come in. Local programs are often stretched in their ability to simultaneously deliver services as well as provide the documentation required by NAPIS. To this end, when will the revised NAPIS be implemented?
Okay, thanks for that question. States will be asked to start collecting data, we understand, on the revised SPR starting in October of 2019, with the first round of data using that form due in January of 2021. So ACL originally wanted to start that data collection back in 2018, but listened, of course, to concerns from the field, and therefore we pushed that date back. So, we understand that data collection can be a burden to sites, so the proposed SPR revision reduces the number of data elements, we're happy to say, by 70%, and the amount of time for completion by 30% as compared to the current SPR. So, again, a pleasing response to that particular question.
Fantastic. Thank you so much. All right, here's another question that's come in. Changes to our national healthcare system have brought about many new challenges and opportunities for the aging network. Short-term and quickly available home-delivered meals are growing in need as older adults return home from outpatient procedures or brief hospital stays in very frail condition. And while some nutrition program providers innovate and have proven effective in stemming the tide of declining participation, there are state and local limitations to improvising the appeal of that program to the new generation of older adults. Would ACL consider any of the following changes to the Older Americans Act in order to allow state units on aging to be more flexible and to extend current resources devoted to the congregate and home-delivered meal programs. This question also goes on to ask, are there possibilities for removing mandatory percentage of funding for home-delivered meals versus congregate? So there's a lot going on in this particular question, and so how do you jump into it?
Excellent. Yeah, that's a $15 question. Nobody gets a pass on that. That's not a $5 question. So I think in kind of taking it in quick succession, let's talk a little bit about what should be obvious to everybody for paying attention to what's happening out of this administration. The president is very much about state flexibility. So in the president's FY19 budget, which again was released 3 weeks ago, you will have noticed in there language about how we want to support that flexibility and really enhance the nimbleness to respond to local needs. So I hope listeners can really appreciate that, and I want to encourage you to be very open-minded about that and to take advantage of making sure that you maximize that gained flexibility if enacted. So that's part of that. Let's talk about, kind of looking to break down to your question here. We're talking about the sliding fee scale. Yeah, okay. That's an issue that we have been discussing. There's not really any consensus, though, specifically about that. So just know that, again, the person that asked that Whopper question should appreciate that is on our radar, that it's being discussed, and certainly be looking for some news coming out of either Resource Center or ACL around this particular topic. So I think we touched upon a couple of the main things.
Great. Excellent. Here's the next question that's come in.
Okay.
Will ACL consider the use of validated food insecurity or other health risk screening tools, or the collection of chronic disease conditions as a replacement for the non-validated Determine Your Nutrition Checklist tool?
Yeah, good question. I'm gonna let we're privileged to have our Deputy Assistant Secretary on Aging with us today. A lot of you know Edwin Walker. He's been around a couple of years, and we're going to pitch this one to him.
Sure. One of the things, as many of you know, that we are doing is we're continuing to have discussions across the aging network with the healthcare sector about how we can secure more sustainable funding for nutrition service providers, nutrition services, the aging network as a whole. And in the context of that, we've often talked about looking at Medicare as a possible funding stream. And we know that when we engage in those discussions, that it requires, or it would require, a much more valid set of screening tools than what we use today in the aging network, even tools that might need to be approved and screened by the U.S. Preventive Task Force, which classifies activities for CMS to consider when they are thinking of including something as a Medicare benefit, which I think has been the targeted discussion and targeted goal in this network for decades. And so we are certainly looking at how we can create a path from where we are today to that point, but we're not there yet. We encourage everyone's support, and if you have ideas about good mechanisms or good tools that we should consider, I would urge you to send those in to Holly. She's been leading up our effort here, working with a number of very bright, energetic individuals, both in the public sector and in the private sector, as we chart a path forward to a more sustainable funding stream.
Love it. Hey, love that. Very good. Thank you, Edwin.
Great. I'll ask one of the questions that's just come in. How is the future funding from the Older Americans Act compared to the need for services? This question goes on to read, how to educate the public about the need and the cost savings in comparison to costly healthcare utilization, hospital stays, Medicaid costs, and long-term nursing home usage. So just looking at future funding, the need, and how to talk more about the impact our programs provide.
Gotcha. Absolutely. I think that was sort of a thread throughout the conversation already, but let's touch it quickly again because it's such an important part to this conversation. So, again, we all recognize that funding has not and probably will not ever keep up with funding. As a matter of fact, if you go back and reread the language in the Old Americans Act, the Old Americans Act funding was really intended to be a catalyst. I think those dollars were intended to help spur along local communities that could use those dollars to leverage and to do some creative and innovative things to help, again, maximize the federal government's contribution. But I think all of us would agree there's not going to be a time when the federal government can fully commit to covering every one of those costs and meeting every individual's need relative to this program. But I would say, though, and I know I'm talking to a group of highly committed and passionate individuals, I think there are many options out there for us to go ahead and create stronger sustainability. Some of that, again, maybe through partnerships, so that as we venture into the coming years, we can have a little more confidence that despite growth in demand, regardless of what happens with the federal dollar side of the equation, we have an opportunity to just keep moving forward. And again, the partnership element's key. I think anything we can do to create greater efficiencies is key. There are lots of other variables that have often been popularly discussed that we don't have time to necessarily cover today, but I think that's critical for all of us to understand and appreciate. So then, as a second part to that question, and Edwin landed on it nicely, within the federal government conversations we're having, there are some opportunities out there that we continue to explore, that we're excited about. We hope that some of our key partners will be able to step to the table and to really kind of pull things together relative to other potential funding streams. And I would say, though, that in wrapping up my remark to this question, one thing we all have to commit to is that quality measure that is so imperative in the work that we do, because regardless of funding streams, if we allow quantity to overwhelm quality, then at the end of the day, things are going to implode. So I just want to encourage folks. Sometimes we tend to focus not always on the right targets. So while I think it would be wonderful to be able to claim we fed everybody, most importantly, we need to make sure we're doing great quality work that proves to be imperative and defensible. And from there, we'll continue to build the support that we can out of DC. But ultimately, I think the best answer continues to rest at the more local level. And again, just appreciate everyone's commitment and understanding of that. So let me also, Edwin's got a couple of additional things to say relative to that.
I think what's also very important for this population and this group of people on your webinar today to understand is that our national nutrition evaluation that has been coming out in phases will also help identify the real value of our program in terms of the costs of the program, what the real costs are, but more importantly, the significance of what is provided in the lives of the people that we're serving, how it is improving their health, and therefore it allows us as an aging services network to make the case on the healthcare side of the value of this program in those people's lives.
Absolutely. And those conversations are happening. That's not just internal talk. We're pushing that.
So keep your eyes peeled for more information coming out of our evaluation.
Fantastic. We look forward at the National Resource Center to provide a platform to disseminate and elevate the good work that you all are doing. So please stay tuned to updates, events, training opportunities through the Resource Center that will touch on how we can move forward and innovate around the quality nutrition programs that you provide, talk about opportunities for outcomes research that really discusses and documents, quantifies the value that you provide out in the communities to those that you serve. We will be seeing many of these exciting opportunities for you to engage, learn more over the course of the year. So please stay tuned. There was a question that came in earlier asking where online that you can go to find the National Resource Center. You are welcome to surf on over to nutritionandaging.org. Often, daily, tag it as a favorite site. We will be uploading more and more information. There's contemporary, current, innovative, and practical information, both for nutrition service providers, for clients, for registered nutrition dietitians, aging researchers. We provide resources and opportunities for education and training for a wide gamut of you all on the webinar today.
And this is Holly Grueling. I just want to reiterate to really visit the Nutrition and Aging website. Our network, our nutritionists in the aging network in the community setting is a very niche market, and we need to not feel like we are at it alone. We can learn from each other if we share information freely to help improve the lives of our older neighbors. As Mr. Robertson said, you know, the program is currently not keeping pace with the population growth, so we have to figure out how to make a dent into those that we are able to make a difference. So please visit the website and also the client outcome evaluation, as Mr. Robertson said, is coming out in the fall. However, it might be earlier than that, so do look for some notice on that. And I would also like to encourage you to share our Facebook and Twitter messages freely. Again, there will be a blog that's coming out by the end of the month, and you are more than willing to cut and paste it into your own documents. These are generated for all of us to use wisely and to spread our message widely. So with that, I think I'm going to turn it over to Uche to close the webinar.
Fantastic, Holly. Thanks, everyone, for your attention and participation and the robust conversation that we had today. You're more than welcome, again, to visit the Resource Center. At the closing of this webinar, we encourage you to complete our evaluation today. The responses you provide are so helpful to us and allow us to improve and provide you the best quality training through the Resource Center. Thank you all for a great webinar today. We look forward to having you join us again soon. Have a great afternoon.